All right, you're good. We're live.
Okay.
All set?
Yep.
If I may, who is 3429? Oh, not
think
that
that-
one.
I think that was Kimberly Byrne.
Yeah, who is the 6196?
It's me, Candace.
Okay, good. All right. I will rename then. Okay.
Oh, there I am. We good to go, Randy?
Yes, sir.
Okay, so I'm going to read off the agenda since I know everyone's got it. I sent it to you guys, but we'll just read it since it's not there. Public notice of Public Health and Safety Committee meeting to be held remotely Tuesday, April 21st, 2020 at 6 p.m. as permitted by Executive Order 2020-07, which was signed by Illinois Governor J.B. Pritzker on March 16th, 2020 in response to the COVID-19 pandemic. To participate remotely, please download the Zoom Cloud Meetings app or call 312-626-6799. And the ID is 496-655-137. I'll start with the roll call. Alderman Fahrenwald.
Here.
Alderman Carr.
Here.
Alderman Johnson.
Here.
Myself, I'm here, and we're missing Alderman Johnny Hill and help me out here, Alderman Cazares. Randy, you want to list off who else we have because I can't see them all.
Okay. In the room we also have Kimberly Byrne and Alan Stevo.
Okay, and both
And
fire
then
chief
Bernie,
and police chief.
the two chiefs, the fire chief and police chief. I'm sorry.
Okay, so under citizen concerns on the agenda, they were supposed to email anything to me by 5 o'clock tonight. That did not happen. I didn't receive anything. We'll start with fire department business. Chief Rita, you want to go for it? First thing on the agenda is monthly report.
Good evening, everyone. Can you hear me?
I can hear you.
Okay. You guys, I emailed that late. My apologies for not getting everything completed. It's been a little bit hectic, and thanks to Chief Arzab, she actually reminded me we had a meeting tonight. So my apologies, but I got most of it done. As you can see in front of you, 302, this is for March 2020. Our emergency call response was as follows: 302 EMS responses, 113 fire responses, of which 13 of those were auto aid responses, respectively 4 to Elsa, 5 to Calumet Park, 2 to Riverdale, and 2 to Robbins, and 2 mutual aid responses. Below that is the services collected from medical reimbursement for our EMS billing for the month. I also included that in the email I sent. For the month of March, we collected $51,888.77, bringing our year-to-date total to $101,424.23. Fire recovery for the month of March, we received $1,740, bringing that total to $6,482.20 for the year. False alarm fees collected in the month of March were $100, bringing that total to $400. Calls of interest, we were fairly busy, but nothing of any significance. The latter part of the month was spent mostly with the COVID response, and it continues through this day. Most of our calls are, at least EMS related, are going to be those for the foreseeable future. So we've stayed busy with that. If you turn to page 2, and that's what I just discussed, obviously general information. We've been busy with our COVID response plan, at least initially. I think we're pretty dialed in right now as far as that goes. We did create an incident action plan for the city, which I believe all of you received, or I'm pretty sure I emailed everybody. So if you did not get that, let me know. I'll be happy to get it to you. And we continue to obviously operate under that for the foreseeable future as well. We did have early on 2 members exposed. That was a result of a call that took place on March 16th, which was really it was a day before it broke loose. So they were quarantined for their 14 days, and neither got ill. One had some mild symptoms, but tested negative. The other one had 0 symptoms and was back. They're both back to work now. Thankfully, to date, we have yet to have anybody sick and off, so that's a good thing. We have had multiple exposures, but they're wearing their PPE. The ambulances, the compartment between the box and the driver's area is sealed, and we decon after every call that is COVID related. And we're also tracking that in our records management system, as well as I have a spreadsheet that we're keeping track of the exposure end of it, should something come down the line later with any of them getting ill. Maintenance wise, the tower ladder's still out of service. I talked to our mechanic last week. He seems to hope that it's going to be back in a couple weeks, so we'll keep our fingers crossed on that. It's going on about 6, almost 7 months that it's been out of service, so hopefully that's back soon. Fire prevention, we haven't done too much in the way of fire prevention, and some of that is to limit the exposures of the guys and fire prevention officers for that matter. So we've halted the pre-plans for the time being, unless it's absolutely necessary to, for a building to get their occupancy or something like that. So the one we did just do one Monday, which I included in for the aldermen in their daily update. We did do an inspection of the former Metro South Hospital in preparation for them to get occupancy with their alternate care facility that we're obviously going forward with over there. So that was the last one that was done. Training, I included that in the email as well. You have a spreadsheet on that. 502 hours of training for the month for all 3 shifts and myself. That should say March. Sorry, that's not January. And then we continue to do the ongoing drivers training. We did hire another firefighter, and we had another one that's actually going to be starting next week. So we'll be continuing with the drivers training for them to get them up to speed through the summer months here. Operationally, most of it's, like I said, it's been related to the COVID stuff. So we haven't done too many different things with that, at least fire-wise. EMS, we have inventoried our PPE. We're good to go with that. We continue to get supplies from the Cook County Department of Homeland Security and IDPH. So those or that PPE is starting to trickle in. We have had donations from District 218, some of our vendors. It's been, what initially started off a little bit slow, and we were a little bit concerned that we might not have enough, at least initially, or we would run out soon. We're in a pretty good spot right now as that goes. So thank you to all that have donated. Thank you to all that have helped. And we're in a way better spot than we were certainly when we started. And then again, the EMS end of it, obviously preparing, going through the SMOs, going through everything that we would normally be doing in these situations. So the guys are prepared to handle what's being, thrown their way. So they're doing a good job. Again, a lot of it is documentation, making sure that we document it and track everything and stay safe. So they're wearing their PPE, they're doing the things that they're supposed to be doing. And so far, like I said earlier, we're coming through this with limited illness, which is a good thing.
All right. Anybody have any questions for the chief? Nope.
Yes, I'm sorry. This is
Go ahead,
Officer
Dexter.
Johnson. I don't know if you can answer it or not, Chief Rita. We had approximately 104 coronavirus cases. Do you have any documentation on like how many of them were seniors? Well, maybe
I do not.
know.
I get the update I get is from IDPH. I can look into, I can try and break that down or get that drilled down to. We have, since you mentioned that I am in contact with Senior Suites over there at Prairie Green. And to date over there, they've had 4 cases that they have reported. 3 of which are not on site. They're in the hospital as we speak. And 1 is being isolated on the grounds there. I just talked to Ms. Brown yesterday regarding that. But the predominantly, and again, I don't have the exact numbers, but the predominant ones that we're transporting and the ones that we've gotten back from the hospitals, we've only gotten 12 confirmations from the hospitals. And as you just said, we have, the last count I had as of today was 96. So predominantly the ones we're seeing, they are older. I'd say from like 55 and up. But
Okay,
I can look into the exact number.
I appreciate it. I've been working with a couple of state reps and different people to actually get us some more PPE, like gloves, disinfectant and things like that. And I wanted to try to gear towards our seniors in the city of Blue Island. I helped fed like 400 seniors today, and I was just wondering if you had those numbers, and maybe I'll try to look into as myself as well as the other aldermen if they could reach out and see what kind of seniors that just don't have the ability to get out and things of that nature that I might can be able to bring them some food.
Okay. And we did send, just so the council's aware, or this committee's aware too, we did put something out last week to the seniors. So anybody that was on the list that both Chief Arzab had and then Clerk Hauser was able to get, we did send a letter to all our seniors that were registered with us and gave them some information on things they could be doing and contacts if they needed help. So we hope that the majority got that and found it useful. And then, yeah, if the aldermen hear any feedback or if they need something different, let us know, because we can incorporate that into another mailing, or we can put them in the public service announcements that we're doing every week, and go through different avenues to try and get that message to them.
Okay, St. Benedict is also giving out lunches and things of that nature. I think it's from 11 to 1, and they also do a food pantry thing, but I actually forgot their days. But I'm just trying to put something together for those people. Want the older people and the kids, of course, to try to, we got to stick together and try to do something positive during this crisis.
Yes, sir.
I got a real quick question for you, Dan. Those units that the finance committee approved to disinfect the rigs in the firehouse, any news on those? You just want to tell people, I don't know if anybody here even knows about those, because that was in finance.
That's right. So what Alderman Klinker is talking about is we ordered 2 sanitizers. They're UV. Finance approved them. We ordered them the next day. I'll call tomorrow and find out. The last time I talked to her, which was last week, they were still, obviously they're not here. She said it was another couple weeks or so, or another couple weeks. So we'll find out. So what those are is that we're going to buy that. That was for the city. It's not just for the fire department. Although we'll probably use it the majority of the time. But we bought a larger one that will be able to, you'll be able to place in a building of some, size. And I think it's up to 2,500 square feet. It will sanitize and disinfect using UV, which they tell us is 99.99% of cleaning capabilities. So, and then we bought a smaller unit that we'll be able to use in the vehicles, i.e. ambulances, the trucks, the police cars. We'll be able to put that in there, set the timer, and it will clean those and do the same thing, disinfect and sanitize the units with that UV light. So I'll check and find out if she's got a hard date as to when they're going to be arriving.
Yeah, I'm sure. I'm sure they're hard to come by. I just was curious, if you had heard anything. I know they told us originally at least 3 to 4 weeks. So,
right.
Okay. Hopefully you get them sooner rather than later.
Yes, sir.
Anybody else have anything else for the chief on the reports? Okay, we have old business and new business. Chief, you have either of those? It's all pretty much COVID stuff.
Alderman Klinker, I'm sorry, I was on mute. I got a couple of questions.
Okay.
Yeah, thanks. Sorry.
Go ahead.
Thank you. Kind of following up on Alderman Johnson's questions. Is there, or maybe anybody else in the city knows, is there any kind of a list of by ward or whatever of folks who need wellness checks that aldermen might be able to have? I'm sure we don't want to be visiting them in person, but at least to check in, make phone call checks or whatever. If there's such a list, it would be great to have it.
Can I jump in here?
Sure.
At one time, the police department did have a list of seniors that needed to be contacted. I don't know if they still have that.
Alderman Farrell, that's the list that we use. We use the police, and then Randy was able to get the mailing and the addresses for everybody at Senior Suites. So that list, Randy, I think I may have it as well. I think I saved that as well. So yeah, we can certainly, I don't see any issue with putting that out. It's not broken down by ward, but it does have a list of everybody. Yeah.
Yeah, sure. That's fine. That'd be great. Okay. Yeah, it'd be good to have. Thank you. Okay, then wanted to ask about, you talked about being in touch with senior suites. I was just curious generally, what is our role? What is our role and, I guess, what is our responsibility in terms of group living situations, whether it's a senior place or halfway house or whatever? What do we need to do in terms of, making sure that they're following guidelines, if anything, and that things are going good there?
That is not on, that's on IDPH. They oversee that. So again, the reason we did that is because we were trying to get ahead of anything that may, and we knew that the mailer was going to be going out and everything else. Marcine had actually called, I believe it was, she called Sarah Brown and had some questions, and she referred her to me. So that's how we got in contact and started discussing the stuff. All of them are supposed to have, any of these licensed facilities should have an emergency operations plan that they follow. It should lay out how they're going to, or, the PPE that they have on hand. Obviously, if there's an outbreak, what they're supposed to be doing, in light of obviously some of the stuff that's going on in communities around us. One of the things that we wanted to make sure is that we were, that they were doing that. So that's why we called a few of the places. We were over there actually, probably right after the outbreak, the heavy outbreak took place. And we got a list. That's how we gathered the master list and everything that we were able to. And we brought them literature and told them what we would be, what COVID was and how, some of the things. And Marcine's been pretty good about the way she's handling it. So she's the one we've had the most contact with. We've tried as we've gone into these other places to give them literature and explain to them. But thankfully, we haven't had a lot of runs to those places. So that's a good thing. But IDPH should be following IDPH guidelines, and they should be making, if they do need, I know a lot of the PPE is questioned right now, but they should be providing the PPE for those entities.
Okay. And then finally, you mentioned that, if I got it right, that a lot of your calls now are COVID related.
That's pretty much there, any difficult breathing, and what we saw a lot of, the symptoms early on were the difficult breathing, high fevers. What we found, surprisingly enough for us, it was the first 2 confirmed cases in Blue Island were no fever, no cough, none of that. It was stomach pain and diarrhea. And those were the 2 first confirmed that we got. So I'm not saying they're all COVID. It's COVID as they're being classified, and our call takers are doing a good job at Orland Central. They have a checklist as to the screening, and when they call in, they ask them a certain set of questions that will prompt them, and they're giving that to us as they dispatch us, giving us an idea of if we should be using, which we are on anything. They're dressing in their PPE for everything right now.
Yeah, right.
But I'd say that probably about 60 to 70% of the calls right now, if it doesn't come in as it, or it does come in, it's being it's COVID related at some point because of just everything that's been going on.
Yeah, I guess I'm just a little surprised, because I would have thought that, frankly, most people would, it's not a sudden onset thing. I wouldn't think normally. I would have kind of expected most people to, transport themselves to the hospital. Are these people who just don't have other means of transport? Are they elderly, or,
That there's a lot of them are elderly. And some of them have taken them, like we've gone and gotten refusals on them. But, just the other day we went to an address, I think 2-3 times. And we transported 2 people out of the house. The initial one, they didn't want to go. The guys came back and said that, they thought that most likely that was probably that at least one of them had them, if not both. And then we went back later that evening and ended up taking both. So I think some of it, and that's why we're, hopefully the PSAs, the stuff that Sarah's putting on the website, all the information that's getting sent out there, people are at least looking at and trying to understand it. We're trying to reach as many people as we can, so to avoid, some of them we told them, at least initially, and that's why some of the symptoms, if they're not presenting, they may not know they're having it, and then they get, obviously worse, and that's when they're calling us. So we, not only just us, but everybody's been telling people, if you don't have to go to the hospital, don't go, because obviously you're going to expose yourself. So I don't know if that's some of it as well, but
right.
we do take a lot of patients regardless. We don't have a lot of people just, especially with the hospital not being open anymore. So that also changes because so you got a lot of walk-ins there. So they don't have that ability to walk in anywhere. So they're calling us and we're taking them.
Okay. Yeah, and I just, you may have not seen this yet. The director of the Centers for Disease Control announced an hour or two ago that they are projecting that this is going to be worse in the winter than it is now. Which is not what we want to hear, but it's something to think about in terms of this may be more of a new normal than we would like it to be. So, okay, thank you very much.
You're welcome.
Okay.
Chief Rita, and I'm sorry, Chief Klinker. Go ahead.
No, that's okay. Go ahead. I was just seeing if anyone had any more questions. Go ahead, Dex.
Oh, yeah, I have questions, and I'm just putting myself out there as well if I could help in any way. But I appreciate what you and Chief Arzab are doing, because this is brand new to everybody, at this level, pretty much. I just happen to have been on board when HIV and AIDS first broke out. But a lot of those facilities where they congregate at, like the nursing homes, senior buildings and things, they do not know. And so I'm really appreciative that you guys went there and checked their plan. But do we know how many congregate places of that nature we have in the city of Blue Island? And, did you guys go through with the master plan? Because they probably didn't have one at all. Like I said, I helped out in the city of Chicago, and in one place there was 200 seniors. Only 3 of those families had Meals on Wheels. The rest of them was too scared to leave, so they hadn't eaten in like a day or so because they had ran out of food. So I'm just saying, I'm gonna go by senior suites tomorrow myself personally, and if I can help in that manner in any way, I will. But if you guys get any information and I can help out, please do not hesitate to call me.
And Alderman, to answer your question, as far as do we know? No, we don't have an accurate count. And if you guys could help with that, that would be appreciated. All of the aldermen, we try to get out as much as we can, but obviously the day is pretty packed full of stuff. So it's not an excuse. I'm just saying that my initial plan was to get it to as many as I could, and it just has not worked out that way. So if there are needs, and that's why we went and put it online as much, or tried to get the message out the way we did as quickly as we could, because if I wasn't able to, or we weren't able to get people into these places, that they had a source to find this information. But if there are ones out there that don't have any information or want more information, by all means send it my way, and we will make every attempt to get to them sooner rather than later. Because the big thing is you're right. I mean, like I said earlier, we're trying to get ahead of all of this, and as Alderman Fairwell just said, discussions with the Cook County Department of Public Health in preparation for setting up Eisenhower as their, every 4 years. I think I reported on this before. We go through the process of getting all the names, everybody set up. So if they were to distribute a vaccine or an outbreak like this, and they had vaccines or they had medicine for everybody, that would be a site to be a dispensary to do that. And the woman had said, this was very early on. This was back in January or February, I believe. And she had said the exact same thing that Alderman Farrell just said, is that, that the initial wave isn't so, it's bad, but they're always worried about the second wave that comes. That's usually 6 months afterwards. So if we look at 6 months after when this all began, we're looking at, again, September, October, November, going into the flu season again. So that's very much on our radar. And again, if we can get ahead of it for the next round, and again, are we going to be able to stop it? Obviously not. Are we going to be able to do some of the things that we would like to do? Maybe not, but if we can, get ahead of it a little bit more and have a little bit more information out there for people, maybe it helps somebody. So that will be our goal going forward, in addition to everything else that we've been doing.
Thank you, Chief Rita. This question is directed to Chairman Klinker. Chairman Klinker, I think we need to have a list of broken down in each ward. That would be easier for us to, to track and try to help each other.
Okay.
As far as the seniors and congregate places, in each one of our wards. the building department should have that list, but I know as far as data, we are so behind the 8 ball. It's not funny. But you know, if anything you come up with, man, please, Chairman, let me know, and I'll try to help you in my best way.
Yeah, that sounds good. You know, Randy and or Chief, if you could email me that list of what you got, we can start with that. I mean, I can go through and pick out who's in what wards, and then maybe I'll just shoot an email to the building department to see what they have, Dex, and also to all the aldermen to see if what they could get for their each ward, for their wards. Excuse me. So yeah, we'll get going on that, Dexter. Good idea.
Yeah, because Blue Cap got a lot of residents throughout the city of Blue Island as well.
Right. Yeah, they have a few group homes, I know. Okay. Chief, anything else?
I did, and again, I didn't get on Monday night's finance, but this might be, we were going through, Topeka had sent, and the reason I'm bringing this up is because it affects our appropriations for 2020 and some of the things that we wanted to do. So I'm just putting it out there for your guys' information right now. Topeka had sent us a year-to-date breakdown on what we've spent for our obviously respective departments. And I found, I won't say discrepancies because they're not discrepancies. I think they're posted to 2020, but they were bills for 2019. And the reason I'm bringing this up is, for instance, what actually grabbed my eye, and it's one of the top line items, is training. We spent $2,000 and we were only allocated $1,000 in appropriations. And as I said to Topeka, I said, that's a problem because obviously now I have zero money for training for the month or for the year of 2020. So I had sent her, I had Andre go back all through and pull the invoices and POs for when they were pulled and when they were dated. So I don't have the answer, but she's looking at all of that. I just wanted to make you guys aware that there's some things that I think it was basically from November and December that ended up getting posted to 2020's appropriations. And there's some line items that we're going to be over on already as a result of that, unless it can get corrected.
Okay, just kind of a side note to that. Last night, Finance Committee, actually last week's Finance Committee, I asked her for current revenue and expense report for all the departments. We talked about it again last night. She emailed me today that she's going to have it to the Finance Committee, hopefully by next Monday for the first quarter. So hopefully between the finance, you and her, we can get it straightened away so that those get charged to where they truthfully belong. Okay. And I think everyone kind of realizes that we're going to go over on some of these things now. I mean, this is kind of, crazy what's going on. So for lack of a better word. So yeah, so we'll get that straightened away.
If I may interrupt for a second, Alderman Cazares is in the room now.
Hello.
Okay. Is anybody else? Chief, you got anything else?
No, that was it.
Okay. All right. Well, thank you for everything you're doing, and we'll move on to police department business. Chief Arzab, you're up. Monthly reports.
All right. This is Chief Arzab. Can you hear me?
Yep.
All right. Good evening, everybody. I emailed you guys the monthly reports for February and for March, so I'll just go through them kind of quickly because they're a little bit lengthy. For February's, we had 2 probationary patrol officers that completed their FTO program. They've been assigned to solo patrol, and they will be evaluated continuously during their probationary period. Another probationary officer has completed stage 3 of his field training program and is expected to complete the program in May of this year. For the monthly reporting, when you guys receive your monthly packets, it's the A, B, C, and D attachments, just like normal. For the clerical totals, for the month of February, the revenue streams, we collected $41,163.72 for February. And then you'll see all the other attachments as well once you look through the report if you don't have it in front of you. The calls for service for February, we had 2,212 incidents. Of those, 959 were calls for service and 969 of them were self-initiated. There were 10 firearms that were recovered and 2 FZO deployments in February. For training, there was a total of 198 hours of training for February and that covers the next 3 pages of the report. We were scheduling AED and CPR refresher training with the fire department for March. And then in reference to our regular training through the Training and Standards Board and through our training unit, which is the Northeast Multi-Regional Training, I believe I had mentioned this to you guys in the past, that there is going to be a funding shortage for police training. And that was in response to the Illinois Traffic and Criminal Conviction Surcharge Fund, as of the result of the HB 4594, which is the Fee Reform Act, which gave judges the authority to waive fee assessments on traffic convictions. As a result of those shortages, that is the sole funding for the Illinois Training and Standards Board. So it gave a dramatic decrease in funding. So the board is trying to go to the Senate with Senate Bill 3739 to introduce that to the Senate, seeking $5 million of emergency funding to fund the training board and the multi-regional training so that we can get some relief with that. But in the meantime, they did advise us that they are not going to raise our training yearly enrollment rates for this year, luckily, but it is possible in the future, looking into 2021, that they may have to raise those fees looking forward. For the overtime, there was $18,774.84 in overtime. Department projects, Lexipol has been obviously in effect since January. We're still working on the procedures manual. The system that controls our key fobs for the police department will have to be updated due to the ransomware that we had last year. We're looking for quotes from Videotech. We're still waiting for Cook County sheriffs to transition us from Capers to Clarity for our records management system. The 2 patrol vehicles that we purchased in January have been fully outfitted and they are deployed. We are still researching a long-term capital improvement / vehicle replacement plan. Our covert detective fleet is aging and out of warranty, so I will be seeking to replace those vehicles at some point using our forfeiture funds. And then I know I had mentioned a couple of meetings ago about the Project Green in reference to our LED lighting. Just to add to that, they also did a check on our air conditioning unit for our building, and they had they provided a grant incentive replacement price of $65,000. The current air conditioner runs on a type of Freon, which is no longer available. It also operates on 4 compressors, 3 of which are no longer working. So we're working on 1 compressor for this building. So there's no other ventilation system for the building. And with exceptions of a couple of windows that we can open on the 2nd floor, all doors and windows obviously must remain closed and locked for security measures. So we're crossing our fingers, hoping that this AC unit will last us another year, and we'll see what we have to do with that. There's some miscellaneous electrical repairs to exterior boxes and conduit, along with outlets and wiring repairs to the police garage, which will have to be completed this year. And we are in the process of disposing firearms being held in property and evidence using gun busters to dispose of the firearms. Our patrol fleet is the same. I believe we had 2, 4, 6, 8, 10, 12, 14, 15 patrol vehicles. 4 of those are past the 5-year, 100,000-mile warranty, and then an additional 2 are past the 3-year, 60,000 mile warranty. Both those have expired. When you get a chance to look at the report, there's the case assignments for the investigations division, cases of interest. On February 8th, 2020, there was a vehicular invasion robbery in the 130-100 block of Western Avenue. Victim was pulled from his vehicle by two unidentified male subjects, possibly Hispanic. The offenders battered the victim and took his wallet, keys, and cell phone. The wallet, keys, and cell phone were located nearby, minus approximately $200 from the wallet. The investigation is still ongoing. On February 10th of this year, there was an aggravated discharge of a firearm in the 2000 block of Des Plaines Street. A residence was struck by a projectile. No one inside the home was injured. Evidence was collected on the scene and has been sent to the Illinois State Police Crime Lab for analysis, and that investigation is still ongoing. On February 23rd, there was an attempted homicide in the 2200 block of 135th Place. Officers responded to the residence for a report of a double suicide by hanging. Life-saving efforts by the FD were performed on scene. Both subjects were transported to the hospital where they received additional medical attention and ultimately survived. The subsequent investigation determined the incident to be domestic related, attempt murder-suicide, and the offender has been charged accordingly. If we go into the March report, the field training officer again, Officer Holloway, he's still expecting to be done with his field training, hopefully sometime in May. We have two officers, Corporal Strezzo and Anthony Cirillo. They have been assigned to the Suburban Major Accident Reconstruction Team, and they are awaiting further training once training is back up and running because of the coronavirus. Various schedule adjustments have been made to the civilian staff and various assignments of sworn personnel to safeguard employees and limit exposure to each other during COVID-19 pandemic. These adjustments are being routinely reviewed by my administration. Department requests for vacation, personal, and comp time have been suspended until further notice. The Frontline Safety Solutions has been provided the department with free online services, including house watches and citizen reportings at no charge during this pandemic, to limit non-emergency contact with the public. And that is up and running on the city's webpage and the police department's Facebook page. All department staff have been issued personal protective equipment and instructions on proper use. Daily cleaning and sanitary supplies have been available to all department staff and instructions on proper use. Suggested protocols and recommendations from the CDC and the Department of Public Health are being followed in response to the COVID-19 pandemic and are being tracked through spreadsheets. Sergeant David Nedved sustained an on-duty injury on April 5th and is awaiting his course of treatment from his doctor. While the severity of his injury is unknown at this time, it is evident that he will not be able to return to work in the immediate future. Officer Eric Stamer submitted his letter of intent to retire from this department effective April 23rd. I would like to thank Eric Stamer for his nearly 25 years of service to this department and the city of Blue Island, while also wishing him well in his retirement and future endeavors. In light of the circumstances with Nedved and Stamer, personnel changes and staffing adjustments were required. Training academies across the state have suspended classes in response to the governor's executive order. This prohibits the department from hiring to replace Officer Ciccarillo and Officer Stamer, and may impede any hiring for the pending retirement of Sergeant Haro in October. The department took possession of 6 Motorola radios that were issued to BAISMA by the Cook County Sheriffs. Cook County has agreed to reprogram them and make any necessary repairs to their radios and reassign them to the police department, eliminating the need to purchase any additional radios at this time. For the monthly reporting for March, the clerical totals for the revenue streams, we collected $41,600.95. Calls for service for March were 2,042. Of those, 964 were calls for service and 760 were self-initiated. There were 2 firearms recovered and 1 EBZIO deployment. There was a total of 198 hours of department training. And obviously, 99% of it probably was online training. We did complete the AED CPR update training thanks to the fire department's assistance. The standardized field sobriety refresher training was canceled amid the COVID-19 pandemic. All training through vendors has been postponed through May, and department members completed FEMA training online. For the overtime for March, it was $8,586.79. Department projects, I'll skip through a few of these because they're redundant from last month's. As far as the covert detective fleet, which I had mentioned is aging, there's an update on that. One of the detective vehicles is currently out of service as the power steering failed on a detective while he was driving. The cost to repair is pending. So I will be looking aggressively to replace these vehicles because they are very old. The agreement between the department and PropertyRoom.com was agreed upon for the disposal of non-evidential property that has been either found, abandoned, or turned into the department as is required to be auctioned by statute depending on its value. The start date for the service is pending. This company was recommended through an evidence management training course and the Schaumburg Police Department. Major police departments that utilize this company are the Cook County Sheriff's Office, Chicago Police Department, New York Police Department, and the Los Angeles Police Department, among many others. The fleet is the same as described in February for the squad cars. Cases of interest for March. March 23rd, there was an aggravated discharge of a firearm in the 2200 block of Collins Street. A residence was struck by projectile from a firearm. Subsequent investigation suggested a domestic dispute occurred across the street from the victim's residence, with the male firing rounds from a firearm. No injuries, nobody was struck. This is an ongoing investigation. March 26th, there was an armed robbery in the 12100 block of Vincennes. The victim was checking his mailbox when he was approached by the offender, who was armed with a handgun. The offender made threats and demanded money from the victim. The victim provided the offender with his money, and the offender fled on foot. This is an ongoing investigation. And then lastly, for miscellaneous, the department is in the process of applying for the Bureau of Justice Assistance Fiscal Year 2020 Coronavirus Emergency Supplemental Funding Grant. This grant is available to police departments that have applied to the Justice Assistance Grant and may be used by police departments to prevent, prepare for, and respond to the coronavirus. Allowable projects and purchases include, but are not limited to, overtime, equipment, including law enforcement and medical personal protective equipment, hiring, supplies such as gloves, masks, sanitizer, training, and addressing the medical needs of inmates. The department is researching methods of upgrading the current facility to limit the amount of contact personnel have with the common surfaces that they may transmit droplets and viruses. Additional personal protective equipment will also be sought with the grant, including masks, eyewear, gloves, and UV sanitizing stations. The deadline to apply for the grant is May 29th of 2020, and the Blue Island Police Department has been allocated $33,354. So we're still in the process of working on that grant as we speak. That's all I have for right now. Anything?
Anybody have any questions for the chief?
I've got one just quick miscellaneous question, Chief.
Sure.
There was, this is sort of miscellaneous, but I've got several inquiries about possible shots were fired Tuesday about 1 a.m. in the vicinity of 127th and Western. Do you know anything about that?
Tuesday?
Tuesday morning, 1 a.m. I heard it from several people, and I just wondered if you knew anything about it.
No, not offhand, but I will definitely look into it and get back to you on it.
Okay, I appreciate it. Thank you.
Yep.
Well, I guess one other thing, have you know, since now that we're in this, COVID situation, if you're, the nature of the things that you're needing to investigate or calls that you're getting changed in any, noticeable way?
Well, I mean, we still have our emergency procedure in line that we only respond to the emergency calls. We do have that site up for the frontline tool online, and then a lot of the calls that don't require an officer to respond, we still respond to those by phone call. So we're still making contact with the complainants and victims via phone calls. So, there has been a decrease in calls, I would say, because a lot of people are understanding the situation that we're in, and they also, want to keep themselves safe as well. So there has been, I don't know specifically, but there has been some decrease in calls.
Okay, thank you.
Chief, can I ask a real quick question? You're obviously still patrolling though, correct?
Yes.
Okay, I just want to make sure that's clear.
Yeah, we always have been. We always have been, except for that one day.
Right. No, I just want to make sure because, so you're obviously just trying to limit contact face to face with people if you don't have to, but they are following up with phone calls and everything. Okay.
Yes, absolutely.
Okay. One other thing I got real quick, and then we can keep moving if anyone else has stuff, is we're still, I think Alderman Carr was looking for 2018's numbers. Remember that when you gave your report for 2019? All the call volumes and all that stuff. And you said you were going to email us the year, I think it was 2018, right, Candy?
Oh, yeah. Yes, I do actually have that. Yes, I will email that to you first thing in the morning.
Beautiful. Okay. And the last thing I have is, so you said you got 6 radios from BIEMA. Any luck on getting anything else? Is that all done, or what's up? What's the status with that?
No, I made contact with Don Marchbanks and Bill Claussens, I think his name is. They have turned in their IDs, their badges, their keys, things like that. There was one other guy that was it the Abels, I think. Yeah, Abels is his name.
Okay.
He reached out and said he was quarantined and he was supposed to reach out to me after that. I've heard nothing from him. And to be honest with you, I don't even know what he has, if he has anything that belongs to the city. Right. And Pronger reached out that he was out of town and he was going to reach out back to me. He thought the first week of May to let me know when he's back in town to relinquish any city-owned property that he may have.
Okay, yeah, I was just kind of curious because I don't even know how many people they had. I don't think anyone really knew who was on their roster or what they actually had. I do know there are also supposed to be 2 new computers over in their office area. So I don't know what happened to those. If we could follow up with that.
Alderman Klinker, is Chief Rita again. We've secured that area, if you will. So we're waiting for them to get back to Chief Arzab to get the. Basically, we have to figure out how they're going to get their personal belongings out of there. From what they've told us, they've obviously provided a lot of the stuff over there is theirs. So, in addition to some of the stuff that we've asked for, we also asked for them to produce a list of what they are claiming to be their personal items, and then we're going to ask them once that's done to obviously go over there and start cleaning that out. so we can then move through. But everything else is secured. The only ones that have keys to it are myself and Chief Arzab.
Okay, great. That's one thing that I know from being on finance when we all got the new computers and I emailed all you guys to see what each department had. Don had responded that they had 2 brand new computers. So just something to keep on your radar when
Okay.
you do go through everything. Okay.
Yeah, we'll go over there and okay.
All right, great. Anything else? Anyone else have anything for Chief Farzad?
Yeah, this is Candace. I do have a question. Chief Farzad, just following up with Dexter Johnson's concern for the seniors. Are we able to pull data from the Smart 911 registrations?
I don't know if that's like age specific. When they register, I'm not quite sure. I can look into it, definitely.
Yeah, because I was just thinking if we could pull data and get people's, I don't think you had to put your birthday, but I think your year of birth or something is on there. It would give us a list of seniors that we could be checking up on.
Sure. And to backtrack on when you said about the senior list that we had at the police department, I know years ago that senior list was generated through Calumet Township information. And I don't know when or ever, if it was ever updated. So we've noticed when we would do some senior checks that it hasn't been updated. So that list that the police department has was from many years ago from Calumet Township.
Isn't there also information that Jim McGeever entered through those forms that we passed out?
I don't know. I'll check on that. I'm not sure about that. I'll have to check into that.
Okay, because I know that was basically for seniors, a lot of that.
Okay, yeah, I'll look into that as well, and we can add all of that information to what we have.
Okay, all right, thank you.
You're welcome.
If I may chime in here for a minute, the list that I sent the mailing to, I forwarded to all the aldermen already this evening. And it depends on how comprehensive of a list you would like. I have also a list of all the people that have senior water rates, or actually the best one would probably be the senior vehicle stickers, but there's only one per household, so it wouldn't be necessarily 100% of the seniors in the community.
Oh, that would be helpful.
That would be a start, because we got to realize a lot of seniors don't drive. Some like living in the senior buildings and renting, where the water bill will not come in their name because it's
Randy,
not their place.
what's the nature of the list that you did send us?
The list that I sent you right now was the list that Chief Rita got from Senior Suites, as well as the list that Chief Arzab was talking about that they had at the police department. That's the mailing that we sent out about the COVID-19 resources for seniors that might not have computer access.
And just so everyone knows, I just was scanning through it while you were talking here, Randy. Probably 80% of those are people at Senior Suites, and there are no phone numbers listed on it. It's just an address. So I don't know how good that's going to get us, because no one's going to answer their door. We're not supposed to be out anyway. So,
Right.
But if we could do that with,
that's the combined list that I did for a mail merge. I think I do actually have the phone numbers for the residents at Senior Suites, but not for the community.
Yeah, you should have the phone numbers, Randy, I think, for Senior Suites.
Yes, I do, but I truncated that list for the mailing, for the mail merge.
okay. Well, whatever you can get, Randy, and send it out. And I mean, if need be, I can kind of sort through things and get it to different aldermen in different wards. It might take me a little while, but whatever you can get to us would be awesome. It'd be a start,
Sure, okay. I'll be
Thank
happy to work on that.
Thanks.
And I also ask Randy another question. Randy, I don't know if that's if this is part of tonight's meeting. You'd sent out that notice about the, kind of parades and stuff policy. Are we talking about that tonight, or is that?
Yeah, that would actually be a good thing for Dan and Bernie to talk about tonight. We talked extensively about that this morning.
Okay.
Yeah. I forgot about that one. Thank you, Alderman Fahrenwald. So in our COVID-19 task force, if you will, group meetings that we hold daily, it got brought up in Monday's discussion, how we wanted to approach doing the birthday parades, some of these other parades that are going to obviously start popping up. You see them in other communities and whatnot. So collectively, we brainstormed today and came up with what you guys received later this afternoon. And we just want to go about it the same way, so we have a little bit of control over who's getting it and where it's going to be taking place. And if it becomes to the point that it's stretching the resources in addition to everything else that we're doing, that we have a means to try and, I guess, I won't say eliminate it, but to limit the number of things that we're going out on a daily basis, because we don't certainly want to, in these times, we obviously want to be able to provide some joy to the community, because there's some obviously value to that. But on the same token, we don't want to put ourselves in a position where we're stretching ourselves so thin that we're not taking care of the other businesses that we have to take care of during that period of time as well. So we felt that at this point, this is the best way to go about doing it, is to be able to, just like they do for, the normal parades that we have in town, and block parties and such, that they contact the city clerk and then you guys as the city council approve it or don't approve it. So it's just a means of trying to be able to get ahead of it. We did quite a few this weekend. I think we did 2 on Saturday and 3 on Sunday. We've had some more requests, and certainly we understand that obviously as word goes around and this gets out, we're going to see an uptick in them. But this was just a means to be able to get to the public and say, this is how we want you to go about doing it. We're not saying that we're not going to do it or we are going to do it. We just want to be able to have an idea of how many we're doing and try and, I guess, control that aspect of it.
Okay, great. Maybe you all saw this also on Facebook today. There was an idea promoted for seniors graduating, from high schools, that they could do it, in a parade rather than on the, kind of on the stage, go through the town, and then go to the high school and have the principal be there handing out diplomas to people in their cars as they pass by, which I thought was kind of a nice idea. But again, I understand the concern about making sure that that's managed. And if they want to, I think your idea is good here for them to put in a request for a permit or permission or whatever in advance. That would be a way to manage that.
And Alderman, this is Chief Arzab,
Uh-huh.
Alderman Farewell. We also would like your, as city council members, we would also like your guys' opinions on what your thought is as far as the governor's executive order, because if you take into consideration what his order means as far as essential and non-essential travel, these, as the fire chief says, we would love to promote these, and people are going bonkers in their homes and they want to get out and do things, and by all means we want them to, but this is considered non-essential travel. So we're crossing a line here as far as should we be allowing it to happen as well, not abiding with the governor's executive order.
Right. It's a good point. And I think that certainly there are things that, we can, I talk about this further later, but obviously there's certain parameters that I think we really don't want to violate. I mean, that 6 foot rule is really important. So physical, marching parades, I think, present probably a real issue there. In terms of, car parades, that kind of handles that problem. I understand your point about being non-essential. But they do also encourage you to get out and do things outdoors that, help, kind of the mental outlook of people. So maybe we could use come from it from that point of view. And I think that, provided that it's not presenting a public safety problem because of the volume of them going on, or, you folks can't manage it. I think that definitely is something we don't want to have happen. So I think the idea here is good, to start with parameters that we require everyone to follow.
Right. Okay.
Alderman Klinker, you're muted.
Thanks, Chief. Randy, you sent out this email looking for a consensus. Are they looking to do this soon, or should we put this on a full council agenda?
Friday. They're having it Friday.
Oh,
Well,
I wish they'd give
that's
it.
the thing. We've approved block parties or whatever when it gets in a little bit late. I just think that both chiefs need a little cover so that they can say, hey, yeah, it was.
I wish they'd given us a little more time because I think this is something that everyone should be voicing their opinion on. I personally am of the opinion of what Chief Arzab just said. I mean, it is essentially non-essential travel. That's my personal opinion, and that's how I'm going to respond to your consensus question.
Yeah, and I've only gotten 3 affirmatives, so yeah, 3.
Yeah. Okay. I just was wondering if we had time to put it on an agenda for a full council meeting.
Yeah, no, unfortunately not. And I don't know, Alderman Carr, if you can, I mean, Alderman Cantello Zillman's already put it out on Facebook, whatever. That's what we talked about this morning. It's already kind of out. So that's where we were looking for a little council direction / approval, consensus, whatever, for a parade.
I missed something. Is something planned for Friday?
Yeah.
Yeah, the District 130 Veterans School,
Oh,
the teachers, last Friday, one of the teacher coordinators sent out an email saying that they thought it would be a nice idea if there was a teacher's parade where they would go around and just kind of wave to the kids from their cars, because they're noticing that the kids are a little down. They're not seeing their friends, they're not seeing their teachers. And this was intended to be something to just kind of lift their spirits and get them back to feeling involved with the school.
okay. Yeah, I personally, again, I don't have an objection to it. Just as an overall objection, but I do appreciate the concerns about not having this get out of control also. So
Well,
Council, this is Alderman
the children
Cazares.
would not be involved in the parade.
I'm sorry, the what would not be involved, Candy?
The children at the school would not be involved.
Yeah.
They would not participate in the parade. It would be teachers in their automobiles.
Right, I understand. Yeah.
This is Alderman Cazares. I admire the resourcefulness of the students of both the graduating classes, but I want to agree with Bernie as well that the non-essential aspect is, the more I think about this, the more I want to lean towards deciding a certain way versus another. But for the time being, I do understand that it's already out there, and as of right now, we're retroactively trying to make sure that this goes off without creating major problems. So if I can offer a suggestion, it would be just to approve if they submit a plan, a route that no major important, it's hard to define important, but no major streets are used or in those routes, because the last thing we want is an emergency response vehicles being delayed or blocked off because of these quote unquote approved parades. So that's my opinion.
This is Alderman Johnson. I wear a few hats. One of them happened to be the president of the Blue Island Untouchables. And we probably won't even have a season this year, let alone a parade. But I kind of understand the point of Alderman Cantello, because the kids' spirits are low. I actually do basketball as well, AAU, and they're not able to even dribble basketball hardly. So just to give them a mental break and just something to just keep them motivated to want to learn and do more, because those are our future leaders. So I think that's an admirable thing. But like you say, staying in the parameters of what J.B. Pritzker put down would be great.
I mean, we open up route. We could ensure that the route is more applicable for a parade by creating maybe no parking in certain areas, so we can at least ensure that there will be 2 lanes on all the streets that these parades are being held. Because like block parties, we block off a street. We can do the same for this type of situation. And again, yes, we want to adhere to the governor's orders, but you know, if we're going to take time to talk about how we can address a solution for this particular quote unquote problem, then we should definitely go ahead. Candace, go ahead.
I don't know what you're asking me
Oh,
for.
sorry. I thought you were chiming in. Well, so yeah, that's my 2 cents. And Dexter, I agree with you. You know, anything that we can support to promote, our children, our residents, or anyone to be a little bit content at home, then yeah, I totally want to support that. But safety is number one.
And if I may again, we talked about this extensively this morning, and I don't know at this point if it's even feasible to stop this one, but I mean, obviously, if we get a group of aldermen that decide that it's not appropriate, by all means, but that was the whole thought process about having to go to council. So you can't just call up one morning and say, oh, hey, Grandma turned 80 today. Let's call and have the police and fire department come out.
I think that's the right way to go. And perhaps if the teachers in this parade, if they could, I don't know how far along their plans are, but if they could push it off a week and let us, pass it through council next Tuesday, that would be ideal.
Well, I know they're having a meeting tomorrow morning at 9:15. So I could call somebody at that meeting and let them know what we decided.
Well, isn't Alderman Cantello part of that meeting? And if so, maybe she could, enlighten them a little more. But I'm gonna be honest with you, I'm okay with it. But of course, we're a collective group. But just putting my 2 cents in, and I'm okay with it because, man, it's something else for our kids not to be able to go to school. And the ones who really want to learn, it affects them the most, and the ones who don't, well, you know how that is.
Yeah, I guess Alderman Johnson, I would have to agree with you on a one-off situation where we haven't had a policy already in place. I'm okay with it too, but it probably needs to be made clear to the public that in the future going forward, we're going to have a policy on it and they're going to have to comply, so we make sure everybody's safe.
All right, nothing else on that? Anything else for Chief Arzab? I think we were talking to her still, right? No?
Nothing more.
Okay. The next thing on the agenda is Alderman concerns or comments. Anyone have any?
Sure.
No?
Yeah, this is Alderman Johnson. This is to Chief Rita. Chief Rita, I got to go through the ultraviolet rays and things to bring you guys some donuts Friday.
No, you'll be all right. We'll just screen you when you get in the door. And if you have donuts, that's a lot easier to get in.
I don't want Chief Arzab to get jealous, but I had delivered them some before, but I had not delivered any to you guys.
Thank you.
We appreciate it.
You're really up in the ante, Alderman Johnson. You're setting a high bar now. All right.
All right. Any other Alderman concerns or comments? If not, my dog's talking. Motion to adjourn.
I move.
I'm sorry. Who made the motion?
I did, Alderman Fahrenwald.
Bill. Okay. And who seconded? Candy.
Yes.
Okay. All in favor?
Aye.
Aye.
Opposed? All right. Our next meeting is set for Tuesday, May 19th, 2020. As of now, it's scheduled for at the East Annex at 6 o'clock. Who knows where we'll be? We might be back on this. So thank you, everyone. Have a good night. Thanks, Chiefs.
Take care, everyone.
Take care. Thank you.
Thanks, Randy. And thanks, Ben.